Okay, so here I am with Jeff.
Hi.
Jeff spent 28 years running human resources operations in healthcare, and he's now a part of the PEG team. So in our last conversation, we talked about how PEG does all healthcare all the time and how we really feel like we can have a significant impact in healthcare by helping to reduce turnover. And one of the questions I had for you was, why is it important to reduce turnover? Like, what kind of issues does that create in a hospital?
Yeah, very good question. Expense. I mean, it's very costly to fill the open positions. So one of the biggest things that hospitals can do is to start, looking at turnover and start reducing it, which in this day and age is huge because hospitals are being constantly being asked to cut back because their reimbursements from insurance companies are not as
robust as they used to be.
Yeah.
So, and I guess it seems like if you hire a bunch of people and then they don't work out, you have to then replace them. You probably spent a lot of money training up those initial people.
Big time, depending on where the person works. I mean, I know in my last facility, hiring a nurse, let's say, it took anywhere from 6 weeks to 3 months to really get them on board with all the different systems that each hospital uses differently. So, I mean, you're looking at 3 months for a nurse, and other positions could take upwards of 6 weeks. That you're not only training that new employee, but you're having somebody that's a seasoned employee take time out of what they need to do to train. So you're basically doubling